Good afternoon, everybody, and welcome to the next in our webinar of COVID-19 and what the reflections are with sexual health. Again, my name is John. I'm from Spectra. I'm joined by other colleagues from METRO and Spectra as well. Again, a big shout out to our commissioners from Wandsworth and Richmond, in particular Julian, who is kind of instrumental with kind of being able to produce these webinars as well. We've done a few in the past. I'm sure from our library you will have seen we've done ones around kind of World AIDS Day, we've done ones on PrEP, and kind of in particular sort of over the past year, issues that have arisen with perhaps young people and COVID. What we thought we would do this time was a kind of reflective look back on kind of 2020, the sort of the pandemic that has been and still is to a degree kind of COVID. I don't think any of us thought at this point last year that we would still be kind of sat here kind of doing things remotely and sort of, you know, talking about, so what job have you had, or what job thing. It's kind of become a new sort of a new language, if you like. The idea of today is to kind of have a chat. We're joined by obviously my colleagues who will introduce themselves shortly, from different sections of the services that we're commissioned to provide, from kind of young people to sexual health outreach to HIV support, and kind of data and statistics. We'll be looking at different subjects, so what has changed, what hasn't changed, what does it mean for the future, etc. So I'm going to hand over to my colleagues now, and I'm going to kind of go on from what I can see on the screen. So first up, I've got Kat.
Thank you. So I'm Kat. I'm the Young Person's Sexual Health Coordinator at Spectra.
Ellen.
Hi, my name's Ellen. I'm the Southwest London and Bexley Sexual Health Lead at METRO Charity.
Cool. And Amanda.
Hi everyone, my name's Amanda and I'm the Head of Sexual and Reproductive Health at METRO Charity.
Dale.
Hi, I'm Dale and I am the Programme Manager at Spectra.
Cool. And finally, Dee.
Hi everybody, I'm Dee Wang. I'm the Research and Performance Manager of Spectra.
Okay, well, that's everybody. I think what we want to do first off is kind of look at some sort of statistics about what we've found from the last year. Dee is going to talk through a couple of sort of PDF screens in a minute, but to kind of give you some background, it's a sort of conglomerate. GMI is a kind of cartel of of METRO, Positive East, and Spectra, and obviously normally we would be doing a lot of outreach work in the communities, predominantly in sort of kind of central London, going into different venues. It could be bars, it could be saunas, it can be sort of other locations that we have the sort of opportunity to reach people. Again, we had to get sort of kind of creative over the past year, and each sort of individual charity kind of did things in different ways. Spectra were kind of quite successful in doing sort of online coaching sessions for people who wanted information around testing, as did, I believe, kind of colleagues at METRO and Positive East. That said, one of the things we did do was a kind of intensive sort of series of surveys. We did one fairly early in lockdown, which I think was around about last April, and we've recently done one over the past few months, of which we're very fortunate to have Dee with us because she presented some of that data at the recent BASH conference. What I'm going to do is I'm going to hand over to Dee, who is kind of going to give you an overview, bearing in mind that this is kind of sort of a reflection of Pan-London, because that was the way the data was presented. So I will hand to Dee.
Okay, thank you, John, and thank you for having me here. I am going to share basically the abstract we presented, the poster presented in Beaver and Bash just last week. It's probably going to be a bit small for you, but I'm trying to make the things that clear when I'm talking. If anyone have any questions or want to have a full access of this, you can actually go to GMI partnership.org.uk. You'll find this on our website. just to give you a little bit more background of what this is about. So as John said, that because COVID heavily impacted our outreach work and our HIV prevention work. So when the first lockdown started, late March, and we decided we need to know how this is going to be. So in a very early stage, we conducted the first study on behalf of GMI. GMI is a partnership between Spectra, METRO, and another HIV charity, Positive East in East London. So that's us as a triangle covering Pan London services. Anyhow, so as GMI, we decided we're going to do a study regarding the sexual health behavior and then the accessing to sexual health services and the need for sexual health service during the lockdown. That is this presenting poster is about. So in this first survey, we had about 918 valid responses. The survey was put online for 4 weeks' time. We mainly pushed that via Facebook, and it's facing all Londoners, regardless of their sexual orientation or the genders. So what we got is, at that time, so nearly 2/3 of people had physical contacts with another person, of which 70.8% of them actually have sex with, oh, sorry, I think I'm just reading the wrong data. Really sorry about that. Now, getting back to the first reports. So we had about 548 respondents in the first report, and the majority is actually men have sex with men, with 35% of non-MSM populations. At that time, we spotted that 39% of all respondents reported not having any sex during that time, which is April last year. And that is especially, there's a huge drop of men who have sex with men who stop having sex, even more so than the heterosexual populations. We also noticed that lots of people saying they have stopped HIV testing, STI testing completely at that time, and especially so among MSM as well. And then a lot of people are actually saying they actually have no or less needs for HIV and STI testing. That reduced about 29%. But some people, I guess because we have a small sample of heterosexual people, they actually reported they need contraception, especially condoms, and then the long-last sort of devices. That has a small increase. So that is the overall taste of the patterns at that time. So we noticed that less sex, less needs for sexual health, and as that's a pattern of that time, which is not surprising. After that, because the government changed our COVID lockdown and COVID measures constantly, literally, and then we do notice there's a relax in June, in the summertime, June, July, August. So we decided that it seems people are reporting they get back to the sex scene. They're getting a lot more activities than they previously were. So we decided we're going to have another survey, which prompted us to the October one. So this October survey, however, is only aimed at men who have sex with men, given our funding situation at the time. In this survey, we do actually spot quite a bit different behavior pattern than the previous one. In this survey, there's over 900 men who have sex with men actually reported to us. And 2/3 of them said that they actually have sex with physical contacts. In total, nearly half of them actually having sex with people from different households, casual partner from different households. Sorry, Tom, that's the second poster. It's P031, I believe. And then those aged under 40s are more likely to have sex with casual partner who they don't live with. And And then we also noticed that people who are already know to be HIV positive are more likely to have sexual partner with casual partner from different household at that time. We do ask people whether they actually adopt any COVID prevention measures when they're dating, casual dating. Just about 58.6% of them, slightly more than half of them, reported they do have certain prevention measures in place. For example, they wash themselves, shower themselves before and after sex. They decided there's no kissing, or the increased condom use, or wearing face masks when having sex. However, there was 1/3 of them actually not doing anything. That's at that time, we think there's a considerable number of MSM in London remain sexually active and engage with physical sex with casual partner from different household. So I think if isolating each survey probably doesn't really mean much to us, but if you put them together, we can see when the COVID measures, when it's tightened, when it's loosened, how, well, at least we can tell the MSM population's behavior change following this. And then I think that's also a pattern we can see at the moment, although I haven't got any data to support me, but we do have been told from our frontline staff that there's a lot of engagement in the cruising ground, in outdoors. Actually, back to the second survey we've done, 1/3 of them actually already having sex in outdoors last summer. So we can actually predict that happening and increasingly happening in the coming months. I hope that's enough. Do you have any specific questions?
Sorry, I think I was muted. No, that's great, Dee. Thank you. I think what we're going to do is we've sent a link to our kind of behind the scenes team, and they're going to put something up on the website as well. Sorry, on the kind of chat line here. So people, if want to, they can access the website and kind of get more information and like look at the drilled down data. Unfortunately, you know, like we've said, this is a representative of Pan London. Breaking the data down specifically to Wandsworth and Richmond wouldn't have kind of been possible at this point. I think for me, anecdotally over the past year, and Dale might be able to might come in on this as well, that I think, you know, in the periods when there was kind of lockdown easing and we were kind of ready to jump back in and start doing sort of outdoor activity or outdoor testing, kind of outreach, that I think that was kind of reflected in the sort of activity that we saw. You know, there was opportunities during the summer to kind of get out and work on PSE areas, in kind of like, I suppose, places like Wandsworth and Richmond, in particular, kind of Barnes Common, Clapham Common, and so on, and more recently, sort of Ham Common. It kind of, I think, there was, for me, I think, you know, the first lockdown was very effective. It basically, everybody just shut down. That was it. They didn't access anything. They didn't want to access any medical sort of help because, you know, basically the message was you stay at home. We're only, you know, you can't go to anything, you can't access anything. It's only going to be about COVID. And so therefore people were like, oh God, okay, that's it. I'm going to stay at home. I'm not going to do anything and what have you. So I think that reflected in that. And then obviously as time went on, people being people, they wanted to kind of get back out and sort of start kind of, you know, enjoying certain activities. So again, Dale, I mean, do you want to come in and kind of give some of your anecdotes?
Sure. Sure. I hope I don't have much feedback coming back through here. I don't know whether it's my laptop or something else, so I apologise for that. But yeah, I have been working at a few of the PSEs or public sex environments over the past few weeks since the 12th of April when we began face-to-face services again. And I'm not exaggerating when I say I saw more people in those 2 weeks than I have probably in my 7 years of combined PSE work in the sexual health industry. And I really don't exaggerate when I say that. I mean, it was when we went to Ham Common, you know, within the first hour, we'd spoken to about 25 individuals just before that was just making our way to the renowned cruising ground. So certainly anecdotally, certainly a really, really high increase, uptake in people using the PSCs in Richmond and in Wandsworth as well. So we've been at Ham Common, Barnes Common, Clapham Common in those areas. And we've actually started to build quite a close relationship with the parks teams already. And they kind of report the same thing, that the activity on the common has increased quite dramatically. And really, you know, a lot of concerns around, you know, litter and things like that, because it's not just the activity at the PSCs that's increased, that's had that effect on the PSCs. Also, when you have like businesses around the area closed for whatever reason, just a lot more people are using these commons and things in general. So there has been a kind of higher increase of people engaging in that kind of activity. So yeah, we've done a lot of work, had a lot of engagement with people, a lot of positivity with people. A lot of the local residents associations and things are getting involved and appreciate the outreach work and the necessity of it. And we'll be hopefully going in there with a testing bus in the next few weeks and seeing if that maintains its kind of engagement, because I assume a lot of that engagement is down to you know, obviously people, flatmates being uncomfortable, of people maybe on Grindr or other social networking dating apps. And so that might have had an effect on it. Obviously the good weather would have had an effect on it. So I think there's multiple ways to be discussed on how the pandemic has affected the engagement at PSCs, but from both an anecdotal and a data point of view, it has increased massively, I would say.
No, I think definitely. I mean, I think, you know, what perhaps it's worth kind of to go around the room, so to speak, and see what if anybody else has any comments on kind of, you know, where we're at the minute, having gone through a year. What other comments people have on having seen restrictions lift? What have you guys? What has everybody else? Maybe, Amanda, if you want to.
Yeah, it's interesting that just listening to you, Dee and Dale, because in a way I've seen almost the opposite with non-MSM or not necessarily non-MSM, but when I'm looking at data around young people specifically, it seems to sort of follow almost on a trend, sort of what the restrictions and the lockdown have been. So at the first lockdown, as you guys said, there was very little, if anything, happening. And I think our orders and our engagement with our programs went down to about 15 to 20%. Then they increased a little bit when the lockdown lifted, and then they decreased a little bit again when that lockdown unlifted. And then they've increased a little bit with the sort of, I think, the better weather as well, but also just with, you know, the return to schools, return to youth groups, etc. And I was sort of thinking as you were talking, I wonder why that is. I wonder why. And then I realized that it's really only MSM that are sort of associated with, or at least have this kind of designated public, what do you call it, PSCs, public sex environments. And I don't know of any PSCs for, you know, young people, for heterosexual couples, for lesbians or women who have sex with women. And so I wonder if it really is just an issue of a lack of opportunity. You know, if they can't have sex at school, they can't have sex at youth groups, they can't bring people into the home, then where are they going? So it's been very interesting that my data has almost exactly followed a graph of what the lockdown has, the restrictions have done. And it really makes me wonder what we're in for this summer in terms of things like healthy relationships, in terms of consent, in terms of testing, access to services, the burden on services. So I think we're in for a bit of a heavy summer would be my anticipation. So yeah, MSM have more fun. I've seen in the chat. Yeah, I think
that's interesting. I think, you know, because let's maybe bring Kat in, because obviously Kat being a young person, you know, I think, yes, you will have a lot to say on the fact, because obviously you've still been having lots of contact with kind of young people over the past year, because obviously that's part of your role. So yeah,
I think it's kind of been interesting, because again, I think there's that kind of the lack of opportunity, as you say, like the young people generally have a lot more sort of unsupervised time, so would, you know, have more opportunities to engage in sexual activity, whereas actually being in lockdown, you know, potentially having your parents at home more, there isn't that opportunity for, you know, bringing someone home after school, and, you know, that kind of thing hasn't really been an option. And in terms of like referrals and things we've had into the mentoring side of things, there have been a couple of referrals that have come in. So one was a young person where they had been found to be engaging in sexual activity at school, and one was a referral for a young person who had been found to be engaging in sexual activity in a public place, and there was CCTV and all that. And it was this kind of massive panic from, understandably, massive panic from the safeguarding side of things. But it's sort of, when you look at the reality of young people's worlds,
where do they go?
Where are they supposed to be doing it? Like, there is that opportunity, that you can't just bring someone home because potentially, so it's this kind of, the opportunity isn't there. And again, I think, the summer, when there's kind of that bit more freedom, and again, at the moment, obviously with schools opening up, there's that slightly more free time of that walk to and from school, and there's that kind of, there's more reason to be outside, so there's more reason to be seeing people socially, and so in theory that then lends itself to more opportunity for sexual activity. What we'd sort of expected referrals wise hasn't yet happened, which I'm kind of, again, anticipating, is this thing of young people moving sexual activity more online. So things like sexting and referrals around young people sending sexualized images and that sort of thing. We've not seen the referrals come in from it yet, but that doesn't necessarily mean that's not been happening. So it's been really interesting kind of seeing the impact of actually how, since the influence of lockdown, I think, on young people's sexual behavior, and actually what opportunities they've had, and then what that means kind of moving forward. It's going to be interesting.
Yeah, I think it's going to be. I mean, they're talking about the penny at the Roaring Twenties again. I'm not sure. Are we going to be going back to the 1920s? I don't know. It's going to be. We're going to come back to young people, but Ellen, what are your thoughts on the kind of the past?
So obviously, like a lot about what Amanda said, what we've kind of seen in the trends and stuff. I work a lot with kind of providers. So I work a lot with like pharmacies, GPs, youth clubs, and obviously services have massively been affected by the restrictions and by the lockdowns. For example, youth clubs either not kind of running or running virtually, or having kind of like limited access. They're seeing less people and in kind of like smaller groups. Also, like one thing that we've really seen is that, so this is kind of what kind of worries me a little bit, because people seem to have sex, but then we've seen kind of quite low numbers in terms of people like accessing screening kits from like pharmacies, for example. We have obviously seen people accessing it online, which is great. We launched our new kind of online service, Get It, which I think we launched at some point last year. So through Get It, young people between 16 and 24 can access chlamydia and gonorrhea screens online, and also access kind of like C cards and condoms, which is great, because I think like a lot of people have maybe avoided going to physical places like kind of pharmacies, and they've also kind of had like really restricted access to obviously schools and kind of youth clubs where they normally would get like kits and condoms from. So we're kind of, so we're really hoping that this kind of online service, that a lot like more kind of young people will be able to access it, and also kind of like physical sites when things kind of start reopening again. But so I'm curious to see what will kind of happen this summer. Obviously, as restrictions ease, will we see like a massive kind of increase? Hopefully people are like staying safe, doing tests and kind of using condoms and kind of other forms of kind of protection. So Amanda, you go.
So I was just thinking, it was really interesting what you were saying, is that really the only marker that we've got, if people aren't testing for chlamydia, then obviously we won't know until later whether there's been an actual increase in rates of chlamydia transmission. But of course, the one thing that you can't delay testing for is pregnancy. If you're pregnant, you're pregnant. Obviously, if you're having any kind of heterosexual sex at all, then one thing that we have seen, particularly at the beginning of the pandemic, is a real spike in terminations of pregnancy. And I actually think that over time, I'd have to double check this once we get offline, but that has actually abated somewhat with the pandemic. And my thought was that at the beginning of the pandemic, when people did have unprotected sex, the risk to them of going to the pharmacy or leaving their home was greater than the risk of potentially being pregnant. And I think that as the pandemic has, people have become, I guess, more accustomed to it, and services have sort of reached a little bit of an equilibrium, I think that people are now going to pharmacies for EHC again, or emergency contraception. And so I'd be curious to know just if that's reflected across the board, that now people are doing more chlamydia screens, now they're getting more condoms, but we won't really know for the next 6 months, I don't think, what's actually happened. But it was really interesting that we had a real spike at the first bit, and I thought people are they'd rather get pregnant than go to the pharmacy, which is interesting.
I think I would agree. I think, and it harks back to this kind of thing at the beginning of the pandemic. It was very much, I think like most people, it was like, oh, it's going to be for a month, it's going to be for 2 months. Nobody envisaged it was going to be for like nearly 14 months, did we? And I think basically the message was very strong. If we can say the government did one thing right, it got the, you stay at home, you don't go out, and so therefore, then all of a sudden things weren't accessible. We saw people kind of wanting to access HIV testing. They didn't, and I think a lot of people kind of went, well, you know what, I can wait. It's only going to be for a couple of months. But then as time went on, that people were like going, well, actually, it's been 3 months. And then you start thinking about, what was I doing 3 months ago? What kind of activity was I engaging in 3 months ago? Where can I go? Where can I get sort of, tested or help? So obviously that's when kind of, over the year, you had to sort of be reactive to what people needed and be a bit more creative, and in terms of signposting online, being able to do sort of coaching sessions with people who wanted to get tested, and at times when we were able to open up or offer sort of face to face, we kind of to make sure that you had stringent sort of protocols in place, PPE in place, because being able to access kind of clinical settings was limited because of again, social distance rules, kind of allocations, things, trying to get a slot was becoming increasingly difficult. So then I think people then started looking elsewhere. So where else can I go to get this help? And perhaps they started to access our services, and I just don't mean Spectra, I mean the sector in general. We then started to see a sort of increase in kind of the sort of questions and the kind of inquiries that perhaps wasn't something that we didn't particularly have engagement from prior to that. I don't know, if anybody else saw that, but I think, yeah, it's only as it's gone on, and we, like you said, we've been in lockdown, we've been out of lockdown. It's kind of, maybe to a degree after this, after the first one, people became a bit blasé might be the wrong word. I don't know. They were a bit, well, actually, you know what? It's fine. I can. As people got used to kind of regulations and what they could do, they were like, well, I need to access this. I can access that. Perhaps things got a little easier. I'm interested to know from people, what they think, what if anything went better during lockdown. I mean, again, for some of our services, they actually, the attendance, especially in kind of our trans groups, our non-binary groups, youth groups, they actually kind of trebled at times because of access to services that may not have been there, or they may not have been able to access in real life. For some people, accessing a venue in the centre of Soho is not something that they're comfortable with, perhaps in wherever they're. I don't know anybody, anybody else want to kind of come in, and if you have any, Kat, you might want to talk about the youth group that we were going to start face to face, but then that didn't happen.
Yeah. So this was our LGBTQ plus youth group, which was due to start based in Merton in May last year, I think, was the sort of the planned launch, and then obviously we were all in lockdown, so it's launched online instead. And actually, what that's meant in terms of attendance is we've got young people from kind of all over, rather than, so it's designed to be a pan-London youth group, and actually because it's online, it's a lot more accessible, so it's kind of broadened its reach. We've got young people from sort of up north. We've got a young person from Northern Ireland, which is just wouldn't have happened if it was, oh yeah, you have to travel to Merton once a week. Like, it's just not viable. And I think for a lot of young people, being able to access these kind of services and things online, rather than having to physically travel somewhere and get there in the first place, you know, and that kind of thing. Without those restrictions, it's kind of made it a bit more accessible, which is kind of, and similarly within the one-to-one mentoring support side of things, the other kind of youth worky side of things, you know, for some young people, the thought of, you know, having to sit face to face with a worker and do sessions is, yeah, that's quite daunting. Whereas doing sessions over the phone or over Zoom is a bit more accessible, it's more comfortable. So the engagement from that side of things has been sort of increased. Also, you know, from a worker's perspective, it means we're kind of in contact directly with that young person rather than arranging a meeting through a teacher or youth worker. So yeah, it's definitely kind of had a positive impact on engagement in some senses.
Amanda, sorry, you were going to say something.
I wanted to put my hand up first. No, I think, Kat, I completely agree with you that, you know, whilst overall the pandemic has been very hard in so many ways for so many, you know, people individually and for their communities. I'm getting really bad feedback. I don't know why. Hopefully it'll stop in a sec. But one of the benefits to us, certainly at Metro, and I think what you're saying at Spectra is the same, is that it's forced us to maybe do, you know, jump forward 5 years in terms of the blended offer that we're able to provide. And it's been very interesting to me that as we're, you know, very slowly easing and, you know, offering, for example, to young people, hey, look, we've been doing these sessions over the phone or over Zoom or over whatever for the last year, you know, would you like to meet face to face? And they say, actually, no, I'd rather keep doing it this way. They feel safer. There's no transport cost. It's easier for them to find the time. They don't need to justify where they're going. And certainly from a service delivery perspective, it means that our staff are in one spot. We can reach more people. We can in a way do more. And, you know, from the boring aspect of cost savings, which of course we always have in the back of our head somewhere, it's, you know, what it means is that the people who really need to be seen in person and cannot be seen in sort of a blended way, there's less people burdening the service so that there's room for them. And then the people who really do just need to touch base, you know, like this, face to face, but in a different way, you know, it's a lot easier. And I think that has been, for me, the overwhelming positive, that we've looked at new technology, we've looked at new ways of delivering information, we've looked at new ways of supporting young people. For me, I'm talking about young people, but all people, of course. This contract is just young people for me. And, you know, it's actually been really overwhelming at how quickly we've adapted and thought, oh, actually, this really works. So there's not all bad, you know, it's not been all bad. You know, certainly, yeah, from our perspective. And it's really surprised me how many people have said, oh, no, let's just keep doing it like this. Okay.
No, I think, you know, it's, sorry, Ellen, I think, but I would agree with you, Amanda. I think, you know, it's, you know, I think at the beginning, these kind of scenarios were very temporary. We thought, oh, you know, it's going to be for a couple of months. It's, you know, and then obviously, you know, over the year, you started to see, well, actually, no, actually this has changed. And like, you know, like you say, it's kind of, it's made services more accessible. It's made, you know, kind of, at a time that was already stressful for people who were not experiencing this, the fact that, you know, they were able to sort of work out their own routine, kind of, you know, sort of make the services work for them and work for the clients, and, you know, sort of counsellors and so on and so forth. There was that opportunity that, you know, it was a bit more sort of what's the word, sort of kind of flexible, I suppose, or fluid, for want of a better word. And I think moving forward, you know, we've kind of seen, well, it's worked for a year and it's worked well for a year. Why would we suddenly think about going back to the way it was? You know, I know there's this need to return to normal in some way, but actually, you know, there's talk of a new normal. And so maybe moving forward, you know, the fact is that, you know what, if people want to continue, you know, online or in a virtual kind of capacity, there will still be some people who do want to kind of do, you know, kind of face-to-face or, you know, get together in a group. So I think it's about how you blend that service and how you kind of offer both. And again, yes, there's an eye on the bottom line, but it's how you kind of make that sort of available for service users. And it's all about, you know, being able to make it available. You know, it's at the end of the day, it's about making it available for the residents of the boroughs that we're commissioned in. Sorry, I interrupted about Ellen. I know you had something you wanted to add.
Yeah, no worries. I was just going to say that, like, so I started at Metro last year in August. I obviously kind of started in the middle of a pandemic, which was really kind of strange experience. But yeah, I'm just like really happy and kind of amazed how we've been so flexible in offering our services. And yeah, I think as with what Amanda said, I think the future is probably like offering a blended option, like for example, like yeah, offering kind of face-to-face services for the people that really want it and that kind of like are really in need for it, but then also, you know, being able to access services such like online. I think, yeah, I think it's starting to work. I don't know what we expected in the beginning, but some of the things actually work really well.
I think, do you know what, in the beginning we thought, oh, do you know what, it's going to be like 3 months, it's going to be over with, it's fine, you know. I mean, on a personal level, I had a flight, I've had to move one flight 4 times because I kept thinking, yeah, do you know what, a couple more months, it's going to be fine, I'm going to be able to go on holiday. And then yeah, I've just given up, it's just been moved to next year. Just to shout out to anybody who's kind of watching, if you've got any questions, please put them in the respective sort of social media channels and we'll get back to you. We had a hi from Medway, so we want to say hi back to Medway to you. I think, you know, again, from a point of view of the service, it gave us a chance to be creative. I think it gave us a chance to kind of do things, to be able to show that, you know, we could be reactive to scenarios and not just kind of go, ooh, what do we do now? We can't do this. Okay, so let's look at, you know, what we can do. I think, you know, Dale, you might have some kind of insight of, you know, have you seen anything sort of change over the past year when it comes to sort of when you've been on outreach and things? You know, was there sort of any anecdotal sort of evidence to say, well, you know, people will change in the future? How do you think it's going to, you know, has it changed? Will it change? I don't know.
What, in terms of services or in terms of client behaviour?
Yes, I think, you know, do you think, you know, in 6 months' time, people will still be sort of a bit cautious, or do you think, you know what, many people are just going to go back to sort of the way things were? I don't know.
It's hard because obviously a lot of people and a lot of kind of groups of people have, you know, sexual engagement has continued throughout. You know, lots of people have kind of, it's important. Sorry, the distinction that I would have to make here is obviously one thing that was mentioned earlier about kind of the distinction between MSM and more heterosexual couples and their kind of sexual behaviors through the lockdowns and things like that. Things like cruising are kind of culturally MSM focused, and obviously because it's not as obviously they can kind of circumvent, you know, like I said earlier about seeing flatmates and stuff like that. So activity like that has continued and has thrived. So, I mean, in terms of actual, you know, if in relation to that, in the kind of heterosexual community, you do kind of have cultures like dogging and things like that. But it's important to note that they are specifically illegal, which might obviously have an effect on it as well. So when it comes to actually legality of the lockdowns and having sex and hooking up and things like that, obviously it's been very muted in the public. And I do think there will be a lot of pent up kind of sexual energy, if you will, ready to be unleashed come June 21st. And I do think over the next 6 months, general public sexual behavior will probably increase dramatically, and I think engagement of clinics will increase dramatically. And as I've been setting up new community clinics since the 12th, I do think actually that whilst there has been some apprehension to go and get tested because some people are still apprehensive of all face-to-face services in whatever manner they may take, the level of engagement we've been having of referring people to places like Sexual Health London and getting home testing kits and things like that has increased quite a lot. And the engagement we've had on NetReach and things like that has increased quite a lot. So what I will say is, whilst I think a lot more sexual activity has continued throughout lockdown restrictions than people would necessarily think, I do think there is going to be a huge incline as well, just simply down to the fact that more services will be available, more venues will be available for people to go out and socialize. I do think the majority of people have stuck by the rules, and therefore I do think a lot of people are looking forward to going out and kind of reliving the experiences they had before. But I do think that this whole pandemic and the society experience of this pandemic will feed into kind of our culture for years, as pandemics have across the world in history. So I do think people, I worry mostly what effect this will have on very, very young people. I've been reading articles recently on how up to a quarter of children now, there's been an increase of a quarter of children under 16 who have social development problems and things like that, and communication problems, which I think is going to feed into their kind of sexual relationships they have, and the sexual communities they engage with in future. So I don't think, in answer to your question, sorry, I'll take it all back now, sorry, because I've waffled on a lot. But to take it all back, I think in the next 6 months, life will probably start to look again how it did before, but I think we won't really see the real effects until maybe 4, 5, 6, maybe even 6 years' time.
Yeah, I think it's, we joke about the roaring 20s. I think basically, come the 21st, it's going to be like, woohoo, and it's going to be a great summer, and people are, which is understandable. It's natural. Kind of touching on your points about young people, I think it's interesting as well, and Kat, you'll probably have something to say on this, the fact that, come September this year, the official rollout of RSE, so relationship and sexual education, which should have started a couple of years ago, was obviously delayed. It was implemented in bits in last year, September. It's officially sort of in there from this year. It's maybe a timely thing then that it is officially rolled out from this, from this year, because of the fact that, like you said, the developmental skills of some children or young people has been kind of, sort of stunted because of what's happened over the past year, down to circumstances of, home life and schooling, etc. And so maybe there's going to be a need with RSE to bring in an element of, kind of the sort of the fallout from COVID. We can't help, I think, like you say, for the next 4 or 5 years, it's COVID, there's going to be an element of everything. COVID's going to attach an element, I think, of everything we talk about. Somebody put one of those memes out the other day going, look, if you've had a bad day, you're just going to say, well, it's been a total 2020, So that's the idea, that you're going to refer to kind of it's going to be the epitome of an actual bad day. It was a total 2020. I think that's hilarious. Kat, I mean, what do you think? Do you think, moving forward, RSE is going to have to do a bit more than just talk about relationship and sex?
Yeah, I mean, I think so kind of two points in response to that. So one is that there are a lot of young people now who've kind of, where schools understandably have had to focus more on the kind of getting the sort of curriculum education done, stuff that would have been covered over the past year and a half in PSHE lessons or tutor time and that kind of thing. The kind of non-academic sort of RSE type stuff just hasn't been covered for a lot of students. And I think particularly historically, schools tend to have a tendency of when we get to summer term, we'll do that relationship sex education stuff. And then you've got a lot of students who now we're in summer term and it's sort of not happened, or there's still stuff they've got to catch up on. And so you kind of missed a lot of that. So there's a lot of that sort of things of how we're going to pick up on that. And I think, moving forward, it's obviously really positive that RSE is coming in, but I think schools are also now in a position where they're expected to have this rollout from September, but they haven't had this the extra year. They've been, busy doing other things. So it's interesting looking at how that actually then rolls out. I think, in terms of content, it's going to be quite interesting because I think there's a lot of work that will need to be done with young people around sort of the mental health impacts and impacts on relationships and socializing and that side of things. On a plus side, again, me sort of silver lining it, I think the way COVID has been spoken about means that in terms of teaching things around STI transmission, young people will have a better understanding of, okay, this is how transmission works. It's the classic poster of how many people have you slept with. The kind of, it's not just about how many people you've slept with, but it's about how many people they've been in contact with, that kind of thing within COVID. And also the term asymptomatic, which we use quite a lot because, we'll talk about chlamydia or gonorrhea, but actually it's now become kind of mainstream understood that you can have an illness and not have any symptoms. And so in terms of teaching sexual health in that side of things, it's going to be really interesting because, the kind of understanding of how things like transmission works, they'll have a basis, but it will all be in COVID. So it's kind of a weird silver lining. But yeah, that's it's going to be interesting, I think, come September, kind of addressing where young people are at, and actually the kind of taking RSE back to its basic sort of form around relationships is going to be really interesting, because we've all had to massively change how we communicate and how we build relationships with people. So yeah, it's going to be it's going to be an interesting year, but I think yeah, definitely kind of it's going to be a sort of novel approach to how that is now addressed within schools and education settings, for sure.
Yeah, definitely. I think this goes back to, I think I can't remember if it was Amanda or Ellen that said, talking about how the levels of testing for things like chlamydia have obviously kind of decreased. Hopefully that's when people get back into some sort of routine, because we've experienced that trying to get back into obviously schools went back, allowing third party to do work hasn't been a priority. We've seen it when we've been trying to do outreach in terms of kind of venues and libraries. Third party, they want to get up and running themselves. So we're kind of seeing that in the next couple of months that's going to get lifted as people get more confident with their own business. Allowing us in to do things is going to be different. I think it'll be similar with kind of schools and activity. And I think kind of we talk about kind of services for. I suppose particularly Richmond and Wandsworth. Obviously, our focus now is to kind of get back out there, start doing outreach, testing in the community and things like that. As I'm sure, hopefully the access through the kind of the work that Ellen and Amanda do within like pharmacies and things like that will increase as well. I don't know if you want to add anything to that, Ellen or Amanda.
Do you want to go, Ellen, or shall I?
I'll go ahead. Yeah. Yeah, so I do think like it will increase as because I think like people are kind of quite quick to go back to normality when something does happen. It's like usually, a really big thing and a really big impact, but like once that's over, people are quite quick to go back to their normal life, like what they would normally do. So I'm kind of thinking that, or like kind of my thought is that probably like we will get busier. And I think like obviously we're heading towards summer, like more young people will have like free time in the summer, like it's nice and warm. I feel like everyone's just a bit happier in the summer, and people do kind of get together a bit more often during summer times. So I do think that we will kind of see an increase, and what we're kind of really trying to do is to really make sure that sites are ready, that like youth clubs, schools, universities, pharmacies, GPs, that they are ready and they have enough stock and they have training and everything to be able to give like a really good kind of sexual health service to young people. But yeah, also in terms of what the Kat said about, like, I found it really interesting, Kat, what you said about how it's probably going to be easier for young people to learn about like STIs and transmission and stuff. And I actually haven't thought about it that way, but that's like a really interesting point. And I do believe that that is kind of true, because now they would have learned so much about COVID and like that you can be asymptomatic and still carry it and still transmit, and that kind of translate a lot to like how kind of STIs can spread and stuff. But yeah, I do think that there's probably still a lot of work that we need to do around kind of communication, around like relationships and stuff, because a lot of people's relationships have massively changed, and the way that people, meet people and engage with other people have massively changed during the pandemic. So I think that is one of the aspects that, we really need to make sure that we kind of incorporate well when we do.
Yeah, I think as well, what we didn't realize is that, relationship-wise, I think, people will have actually spent more time with people over the past year, and then that's a new dynamic for them, because it's kind of, a lot of us live our lives very busy, and we're kind of ships that pass in the night, and it's kind of, maybe only see each other for an hour a day or what have you. So then all of a sudden, and you've probably been sat in a room with somebody going, why on earth did I ever kind of see myself in a relationship with you, or what's happening? I need to reevaluate my life, or kind of,
some of us ended up back with our ex, just saying. That happens.
Well, I'm sure there was kind of like over the year, kind of different scenarios that has happened. I know a couple of my friends have sort of formed bubbles with kind of ex-partners and what have you, and it's worked well, and what have you. I think it's kind of brought to the fore a lot of things that will sort of have parallels with the kind of work that we do, especially, from, again, I hadn't, your point about kind of talking, aligning things to how COVID works aligns very well to kind of talking about other kind of things like STIs or HIV or so on and so forth. And perhaps it will be in people's conscious more about the health, about taking care of the health, about how you access things and so on and so forth. And maybe, because beforehand, it was easier to access things. People now appreciate more that, the services that are available. Yeah. I'm aware that we're kind of sort of on the kind of last kind of 5 or so minutes. I kind of like, I suppose, be able to go around the room and just perhaps pull out anybody's sort of, thoughts of what about for the last year, how it's reflected on the kind of work that we do within sexual health, hopes for the future and things. I don't know, Dee, I know you are kind of sort of a very much a stats kind of person. It'd be interesting to see that over the year, if you've kind of come across anything or noted any things that might be cause for concern.
Well, to be honest, there's just not enough data to tell anyone anything at the moment. I think even just in Beaver's conference, I think everybody got the picture that there was a lot of sexual activities during the lockdown, obviously. However, many of us actually are predicting the bounce back and increase, disproportional increase once the lockdown eased. Also, actually, when we did the first study, it wasn't just survey. We also interviewed some of the participants and asked them about this, whether they can think of any compensational behavior after lockdown finished. I think the majority of them during the interview say, I can totally picture myself actually going back to have more sex than usual, because that's just, people are getting horny. Let's put it this way. It's just a fact. I think, unfortunately, I have to say there's not much data. I was actually looking for STI data, see whether there is increased STI. Unfortunately, the Sexual Health London hasn't got any data published, and they didn't say anything. So there's nothing for us to really share with you.
It might be interesting, I think, to kind of maybe in, 6 months after lockdown has eased, to then kind of revisit and sort of, do a post-lockdown activity. It would almost be great to kind of like contact those same people and go, well, have you changed in some ways? I don't know. Yeah. But yeah, I think it'd be interesting. Dale, sorry.
I would just say my final comments on it really would be that this whole pandemic and kind of from about March 2020 to now has really, for this industry, been somewhat of a professional stress test for the community sector and the third sector model, and has kind of tested a lot of the organizations within that model of whether their purpose of being more adaptable than the public sector per se, that's the perception of many, is actually true, and whether that has worked. And I think to many degrees it has worked. And I've seen lots of services, don't just want to talk about Spectra, but lots of services that we work with have adapted. John has even mentioned before, some of our projects have seen more engagement than ever before. Our trans groups, for instance, one of our trans groups increased sort of quarterly engagement by about 10 times, and that's not an exaggeration. So, some of our services have performed exceptionally well, others not so much. And I think that really this pandemic has been a wake-up call for the industry as a whole to determine what works, what doesn't work moving forward in a post-Brexit, post-COVID, post-modern 2021 world. And I do actually think there's a few more years left in this sort of community model yet, that a lot of people had really thought maybe this was the end, or at least approaching the end, particularly with the way funding was headed and things like that. So I actually think as much as it's been incredibly difficult, it's actually turned everything on its head and opened up new opportunities and new ways of thinking. And I actually think this sector will survive a good couple more decades than people think maybe initially did.
Yeah, I agree. I think it kind of gave us a chance to be kind of a bit more creative as well with things. It gave us perhaps time to, to think outside the box, to do different things, to kind of still deliver services, which is what, we were kind of, commissioned to do, and what, we want to do. Amanda, sorry.
Oh, no.
I was going to hand over to you.
Okay. Oh, no, it's okay. Yeah, I suppose just as a final thought, I really echo what you say, Dale. And I think, we sort of talk, and I think it's human nature. As you were saying, Ellen, I think it's human nature to, or maybe Kat, sorry, one of you was saying about, we do tend to revert to type, as quickly as we can, because that's just how human beings are. But I think, Dale, what's going to be really interesting for me is like you, looking, 6 months, but also 12 months, 24 months, 36 months, whatever, into the future. And really thinking, what has been the impact of this? One of the things that I'm always really interested in is looking at the impact of things like porn on the development of young people. And the thing that always gives me some sort of comfort is that it's often mitigated by real life experience. And I really wonder what's going to happen for this, young generation who hasn't had that mitigation with personal experience. So I'm curious about that. I think we're going to see some divorces. I think we're going to see some long-term commitments. I think we're going to see some breakups. I think we're going to see some babies. And I think that we're probably going to see a lot of, as you say, it's almost like a pendulum. We've been so far this way that we might be switching this way. So I'll be very curious to see whether my gut instinct is right, that we're going to see a lot of risk over the next little while as people go, oh, thank God, I'm free again. Or feel free, I suppose, is it? So some good and some bad.
Yeah, I mean, I agree. One of the things that I think in the first lockdown, and I think I talked to Kat about this, was especially for young people, and I think we made a few misassumptions as well, because we just assumed young people, on their phones all the time, they're going to be easily accessible. I know Ollie, one of our other kind of sort of young person workers, has kind of had issues with engaging with some of his young people because they've not engaged, because the gatekeepers of schools haven't been there to sort of, sort of be the conduit between our workers and what have you. I think one of my concern was, you've then got young people on their phones at home, perhaps left to their own devices. What are they going to do? Are they going to be sending out are they going to be sexting? And then what are the ramifications after this is over, when they go back into a school environment or they go back into the real world? What is the fallout from that? That was one of my concerns. And are we going to deal with that as a service as well? I think that was an interesting point. Dee, I think you stick your hand up.
Sorry, I was just about to add a few more things. I was like, I agree with what everybody's saying about new opportunities. Actually, even for the service that's been affected the most, like HIV prevention work, we actually did see a pattern. Like every time when we get out, when the drop-in sessions opened, we see more people than usual. There's definitely a need there. It's like usually we have average of 2 to 4 tests per outreach session. Now we can see a bigger increase of footfall for every outreach session. So you can see people actually do want to see service being provided in the community setting. I think this is a opportunity for community working sort of a style. And also, I think we can probably expect a reduction of maybe sexual health service from NHS in the future. I mean, that's basically more need for community like us and charity like us, like we, to offer this kind of to fill this gap.
Yeah, I think, for me as well, one of the things I've always said is that over the past year, at times when we were on lockdown, I felt personally that, services like ours should have been able to kind of continue offering especially like point of care testing and things like that, because as we saw the pandemic extend again, like I said at the beginning, those people after the initial 3 months were like, oh, it's fine, I can wait, I can go, I'm okay for 3 months, I can, as you went, we saw that when we first lifted the kind of sort of deluge of people wanting to get tested and things like that. And then as we locked down again, it would have been good to kind of go, well, actually, we need to classify ourselves as an essential service to be able to carry on offering that. I think that because of the fact that due to logistical reasons and, all the kind of COVID restrictions, sexual health clinics weren't able to kind of fulfill what everybody needed. And so, but like we said, Dale said, directing people online and things, was an alternative in a way. I'm very conscious that, we're kind of running over a bit. I know Ellen and Kat, Ellen, if you've got any kind of last kind of comments or things.
Yeah, just like kind of something brief, just to kind of like, I think that everyone's learned a lot from kind of obviously this kind of past year, over a year that's been, and I think we've learned to be really flexible and to really listen to kind of the needs of young people and to kind of like offer them like different ways of kind of accessing services, which has been really good. It will be really interesting, like looking in the future, but I don't think we'll see this until like, I don't know, years after, but how it has really kind of impacted young people's kind of sexual behavior. And I think what Amanda said as well about porn, like I think that's been a massive thing. And also now that like people haven't had as much kind of physical contact, they might have been more reliant on, for example, things like sexting and pornography and stuff like that. And it would just be really interesting to see how that has, affected people and people's behavior. But yeah, that was kind of what I want to say. So I'll pass over to Kat.
Yes, Kat, you have the last word.
I think sort of similar. It's going to be interesting sort of seeing as time goes on, actually being able to see kind of the impact, both positive and negative, because I think, we're quite able to sort of see, for us, how services have been able to become more accessible and that side of things, but also, just recognising the impact on kind of social relationships and stuff. Just kind of picking up on that and going back to the sort of starting point when we were looking at the GMI data of actually the conversation around what COVID safety measures people are putting in place if they are having sex with people, and actually that whole thing of a lot of the work we do with young people around negotiating condom use, and actually if as adults you're kind of having to have these conversations around like, well, are you going to keep a mask on? Are we going to shower before and afterwards? Are we going to sit 2 meters apart? Are we going to be outside? All that negotiation around what do you need to feel safe in that instance, again, is quite transferable to then these conversations around sort of safety and contraception and all that sort of stuff. So I think there's kind of positives in the behaviours that we're kind of all learning and sort of taking on as sort of normal over the past year, and sort of interesting seeing how that then plays out in those kind of social and sexual relationships for young people. Yeah, but I think, again, it's going to be, the impact is going to be seen for a long while yet.
Indeed, it's been an interesting year, and fingers crossed things are going to get back to normal. I'm going to wrap it up. I'd like to say a big thanks to everybody who took part. Again, it's without, we can't say a thank you without mentioning Julian at Wandsworth and Richmond, kind of sexual health commissioning teams. Obviously, we're starting our kind of return to services on outreach within the boroughs. Obviously, all the details will be on our respective kind of websites, or we'll be promoting on kind of respective social medias as well as to what we're going to be doing. We're hoping to kind of get our sort of bus up and running as well, to be able to do some shifts in the area. But until our next event, we're not quite sure when that is going to be. I'll say goodbye and thank you.